It's great to welcome to the program today Andrew Lakoff, who's a sociologist at the University of Southern California, also author of the 2017 book Unprepared: Global Health in a Time of Emergency. Great to have you, Andrew.
Thanks for having me. Great to be
So
here.
it's become very in vogue now to point to, Bill Gates and his TED talk about at some point we're going to have a pandemic that we're unprepared for, and so on and so forth. And I think for our conversation, I want to focus in a little more on the nitty gritty that you've researched and reported on and some of the specifics. Maybe to start with, we can talk about this national stockpile. What are the origins of the national stockpile? What types of components are there? We know, of course, about masks and ventilators now, but what's the kind of genesis of that stockpile?
Well, there are two parts to the story. The very first idea of a stockpile of essential supplies to be used in the event of a catastrophic event took place during the Cold War. The Civil Defense Agency built up stockpiles all around the country of essential medical supplies. Now, by the 1970s, those, of course, hadn't been used, fortunately. We never had a nuclear war. That stockpile was closed down, but the idea was rekindled in the 1990s in response to the threat of a bioterrorism attack. Officials in the Clinton administration were worried that stockpiles of bioagents like smallpox and anthrax that had been accumulated in the Soviet Union had gone missing and might be in the hands of terrorists. And they began to think about the need for stockpiles of biomedical countermeasures in the event of such an attack. So that really got put in place in the late 1990s and early 2000s.
And what are examples of specifics that are part of these stockpiles?
So initially, in response to the threat of a bioterrorism attack, a lot of the elements of the stockpile were specifically focused on possible terror agents. So there were nerve gas antidotes. There was millions of vials of smallpox vaccine, anthrax vaccines. So a lot of medications in cold storage, eventually antiviral medications in preparation for pandemic influenza. There also were non-pharmaceutical supplies. For example, and there's been a lot of discussion of this, ventilators, protective equipment, that kind of thing.
When it comes to the ventilator, I don't even really want to call it a debate, but what was for a while fear of a shortage and what I would characterize as the federal government's slow implementation of distributing. I mean, I think that some of those ventilators could have been distributed far earlier at very little cost. If they end up not being necessary, okay, you send them back. What else sort of should flesh out our understanding of the ventilator piece specifically? I mean, in terms of certainly creating new ones, we know that the manufacturing process is not, you have them in 48 hours. We're kind of now building up a supply which will be manufactured over the next 3 months. But what insight do you have into the entire ventilator situation?
Yeah, I guess to step back to step back a little bit, the important thing to keep in mind also is the process of distribution. So a lot of planning and thought went into, once you have supplies available, how do you decide where they should go? How do you get them to the right places? How do you keep track of how many supplies of a given item you have and where they are among the various stockpiles in different parts of the country? So one piece of the story is, of course, do you have enough of them? And that's the question you asked. But another is, how do you get them to the places where they're needed?
Yes. And when it comes to that, is it unrealistic of me to think that in late January or early February, there were likely the signals that would have supported starting to deploy them to urban areas in some way? Or is it unrealistic to think that that would have been an appropriate time to do it, to be proactive?
Yeah, an important part of stockpile planning is to put in place the stockpiles of items where they're needed as soon as you get a signal that there might be a disaster on the way. So that's right. As the World Health Organization was putting every nation in the world on alert in late January, as officials were beginning to counsel the administration that there might be an epidemic of a very dangerous disease on the way, in particular a respiratory disease, indeed, that would have been the time to start figuring out whether we had enough ventilators and whether they were in the right place.
So one more thing on the stockpile thing, and then I want to move on to a few other things. Jared Kushner had this very strange Orwellian moment where he said the stockpile is our stockpile. It's not the state's stockpile. What I didn't that I don't even know what to make of that in the sense that, well, everybody, I guess, unless you're in Guam or Puerto Rico, you're in one of the states. Like we are the states. But is there anything about the stockpile's origin that makes that statement less Orwellian?
Well, it's a very confused statement. It doesn't understand the whole premise of how governmental preparedness has to work in a federal system like the United States. The whole presumption of a system that is run by the federal government is that states would make requests to the federal government for the items when they need them, and that there would be a elaborate and sophisticated coordination between the federal government and the states. So it's not a competition between the federal government and the states. It's not that it belongs to the federal government or us, whatever Jared Kushner meant by us, but rather the real effort is to figure out what do states need and how can we get that material to them.
Yeah, elaborate and sophisticated is not matching up in my mind with a lot of what we've seen. So let's. What are some other ways in which, as a planet, we are sort of underprepared for this type of 100-year pandemic that we're experiencing now? I mean, we know we don't have a vaccine, but that's a process. You need to sequence the virus, and then there's a process to go through. Most optimistically, there'd be, emergency use vaccines available in the fall for healthcare workers, and then we're looking at 2021. We talked about the ventilator distribution component, although fortunately the actual shortage in the US has been minimal. What are some other ways that we're fundamentally underprepared for dealing with something like this?
Well, I think what we've seen in the last couple of months is that you could have pretty elaborate and sophisticated preparedness plans in place. And in fact, under the Obama administration, very detailed playbooks were put together for each step of coordinated response to a potential dangerous epidemic or pandemic.
Yes.
But if you have those in place, but you don't know you've got the plans, or you're not aware of the plans, you haven't practiced them, or you even don't take them seriously, then when the actual event happens, you're not going to respond adequately.
But are there some other bottlenecks that are very specific in terms of, I mean, international travel is very different now than it was during the 1918 flu pandemic, and the speed with which pathogens can be moved around is a part of it. Which systems are simply not prepared to really deal with this at the start?
Yeah, I mean, I think that it's really a variegated story around the world. I think you can look at countries like South Korea or Germany and see that although, of course, there's not yet a vaccine and there's not even an effective medication, there are non-pharmaceutical interventions, especially combined with widespread diagnostic testing, that can do a decent job of mitigating the disease threat. Obviously, they can't cure it, but so in certain countries that really have thought carefully about how to do this and have strong health systems in place, where it looks not so catastrophic. In other parts of the world where you don't have competent government leadership, you don't have a really strong health system, you have a lot of economic inequalities, that's where we see the catastrophic event unfolding.
One of the things I've been pointing out is that the virus has exposed the underlying fragility of a lot of the systems that sometimes feel very, very solid. And we could find 3 months ago, we could have found a number of indicators of the American economy that weren't great, right? I mean, huge inequality and wages have been stagnant, et cetera. But by the traditional measures, the economy was humming along quite well. High consumer confidence, low unemployment, high stock market, et cetera. The fragility that is exposed by a complete 180-degree turnaround in just a few weeks, for me, has been one of the most stunning things. And I don't know that the system we have doesn't reward being proactive. It's not that profitable to be proactive, but that's been a huge thing for me.
Yeah, no, I completely agree. Not only is the health system's fragile, the supply chain system is fragile, the security of what we call essential workers is precarious. One thing that preparedness planners didn't think a lot about was the how to deal with the economic after effects of these non-pharmaceutical interventions like social distancing measures. So I think countries that have a much more resilient economic system in place have turned out to be much better prepared than countries like ours that really focused on efficiencies at the expense of resilience.
That's interesting. We know from a medical perspective that certain countries were far better prepared. South Korea certainly comes to mind. But which are the countries that economically were much better prepared?
Well, I would say that countries in which it was taken for granted that you would actually provide stable income. So you look at some of the Western European countries that have instead of furloughing workers or laying off workers, have kept workers pretty much on the job and employed through government payments. I think you need an assumption of a social welfare system to pass that kind of legislation in an emergency context, which is something we, of course, don't have here.
Are there other countries? What other countries are at the top of the list in terms of dealing with the medical part? I mean, what's happened in South Korea is incredible. They still don't have
Yeah.
300 deaths. Deaths. They don't. They're under 300 deaths, which is just stunning, given that their first case was officially found within hours of the first U.S. case. Germany has done well, although they had a far larger outbreak, and I think it was just a little more advanced by the time they got around to it. There's a lot of debate about what's happening in Sweden, certainly a higher death rate now, but you're sort of taking a bet that maybe the subsequent waves won't be as deadly because you'll have higher immunity. We just don't know. My view is that we just won't know that for a while. What are the other countries that medically have done the best?
Yeah, and one thing I agree with you about the uncertainty about the outcome in a place like Sweden. But one thing I would say is that, insofar as a claim is being made that we're kind of accidentally following the Swedish model, in Sweden they have made sure that the health systems are strong and that people
Yes.
will have available medical care. So it's one thing to let things go without a plan in place, and it's another thing to sort of carefully keep things less shut down than elsewhere when you know that you're going to be able to provide serious medical care for those who do get sick. I think the other countries to look at very carefully, although of course they're different situations than the United States, are East Asian countries. So Taiwan, Singapore, places that experienced SARS were very proactive early on in January, putting in place testing systems, contact tracing systems, isolation practices, in some cases closing down schools and businesses early, and in other cases not. But it looks like those countries have, for the most part, weathered this much better than the United States has.
One of the ideas that's floated about when we look at some of these other countries is that we can't really do what some of those countries do because they are far more authoritarian. Now, with the case of South Korea ranks higher than the United States on the democracy index, only slightly so, but they do. And certainly to say that South Korea handled it because they're an authoritarian system of government seems completely false. When it comes to some other places, is there anything to the idea that not all of these measures would be tolerable in the United States politically?
Well, I think, again, just to add to your point, a place like Germany, there's no way you could make an argument that contemporary Germany is more authoritarian than the United States.
Yes,
But it
true.
really has to do with competency, trust and expertise, proactive government intervention, and trust by the public in that intervention. So it's not so much a question of authoritarian versus democratic, but when you have a liberal democratic country, what kind of system do you need to have in place? Which, of course, we had planned for such a system here that wouldn't invade fundamental rights. The problem is we didn't implement that plan.
Last thing I want to touch on going forward, there may be a second and third wave. There may just be a second one. This first wave may never really diminish, and it may sort of go into the time where we would potentially have a second wave. We don't know the timeline for a widely available vaccine. We don't exactly know when any of the 70 or 80 possible treatments may turn up to work very effectively. There's economic concerns. We still aren't testing enough. What are you looking at, and what would be the lowest hanging fruit to do over the next 6 months?
Well, I think what we're obviously going to have a period of trial and error over the next 6 months as we figure out what works and what doesn't work, because obviously we won't have a vaccine in that period, or it's very unlikely we would. Um, I think what I'm looking at is just the extent to which we're not flying blind as we go forward. How much are we actually tracking what's going on and proactively intervening before things get bad again each time we try to lessen our social distancing measures? So the more information we have, the better, and the more that information ties into actual rapid policy decisions, the better outcome we'll have over the next few months.
So it sounds like, at an absolute minimum, no matter what the trajectory is going to be, if we don't have dramatically more testing, we are going to be short on the information we need to really make informed decisions.
I think that's right. We need more. We need dramatically more testing, but we also need to know what we're going to do with the results of those tests. We actually need a plan that links tests to policies. So it's not just the testing, but also acceptance of guidelines from a central coordinated government effort that will lead to less bad outcomes.
We've been speaking with Andrew Lakoff, sociologist at the University of Southern California, also author of the book Unprepared: Global Health in a Time of Emergency. Andrew, I really appreciate your time today.
Thanks for having me here.